presentation there, so you can let me know when it's time. Right. Good afternoon and welcome to UnitedTV. My name is Kemal Erkan. Today is April 11, 2025. Today we are going to go ahead and get some of our updates, and there are a couple discussions that we are going to have with some of the current topics. And later on in the session, one of our directors, Anthony Onugu, is going to join me. But before we start with the actual discussion, I'm going to give you some of the updates. 28th Eurasian Economic Summit is coming up May 6, 7, and 8 with 23 different countries, including one president. I believe this number is going to change. There will be 2 sitting presidents, 13 former presidents, 1 royalty, 1 autonomous governor, 3 speakers, 4 ministers, 7 former ministers, former prime ministers, and 5 former ministers are already confirmed. This is one of the most prestigious gathering in Turkey, and we are proud to be part of this. And the Marmara Group Foundation is responsible for putting this event together. Marmara Group Foundation is one of the most respected civil society organizations. And under Dr. Hakan Suer's leadership, it has achieved so many national and international successes, and it's widely known by most of the regional countries in the region. So the goal of the foundation is the global movement for peace and civilization, and it's a big supporter of European Union alignment, and we are going to see more progress, I believe, in time, and I will be there in this event in May, and then there will be several other people, and I am excited to be part of it. Now, I also want to give you guys the update for our upcoming confirmed guest. Sarah McBride is going to be joining us. This will be her first after she took to office as the Congresswoman. This is going to be on April 25th. And then we have Food Bank Chief Operating Officer Larry Haas. That's going to be happening on May 2nd. And then May 29th, we are going to have Seema Verma, the Senior Vice President of Oracle, and she is going to be with us. So these are our upcoming events. Now, what I would like to do, again, there are a couple other updates. One of the peace talk actually is happening right now in Istanbul between Russia and United States. This is very important and also extremely sensitive. And I think Turkey's role in the global level, now it's well recognized by everyone. I think President Erdogan, his leadership and his team actually is doing an excellent job in terms of staying on the neutral side of this, where Turkey can be the mediator for many of these conflicts that we are dealing today. And being a mediator is not an easy task. You have to be trusted, and I believe Turkey earned to do that since the peace talk actually is happening in Istanbul as we speak. Last time this dialogue was happening was in Geneva in 2021, and I believe this is going to bring a lot of good progress to the Ukraine-Russia war. Now, our last update, again, because we are covering these time to time, our U.S. Secretary of Defense, Pete Hegseth, actually he visited Panama Canal. And this is important because of so many different levels. The Panama Canal actually is extremely important for not only for the United States, but also for the global trade. So this is about 5% of the total global trade actually going through this setting. And one of the biggest issues is what's happening with the Chinese government and their influence in Panama. And I believe this is the right direction for U.S. is taking to secure the future issues. And this is a very good way to proactively take care of these issues. And hopefully they can actually, they can do the execution of these. This is where we kind of see the Trump administration in trouble, where in many ways there are a lot of things needs to be done, but then how it's being done is important. So I'm hoping that execution of these are going to be important, because again, this is not just for the U.S., but it's for the entire region. It's important. Now, today, Anthony is, as he's one of my trusted directors here. Every time I have an issue that requires another partner to discuss, he's available for me. And today he's going to join me. And Anthony, how are you doing? So this is your first time in the studio. So it's different, right?
Yeah, different.
Different than the Zoom.
Yes. Thank you for having me. It's good to be here.
Well, it's good to have you here. So now on Thursday, almost every Thursday since the pandemic, you have prepared PowerPoint presentation for our physicians. And I know you work with our team and then putting all these things together. It's almost like you are doing on Thursday nights what I'm doing on Friday with this event. So trying to put relevant topics together and then see why these things are important. And now, although it may look like it's just like two countries are maybe fighting, but it's not. In reality, it's a very different situation, because it's going to impact everyone from anyone who lives in this country at any different level. It's going to impact. So it's not like two country leaders are fighting or having a disagreement, because we are going to pay the consequences are being paid by the public. So we need to actually have a really good understanding of what's happening. Now, where I'm going with this is the unfair trade policies between U.S. and China. And if Ethan is able to keep up with me, I sent him a couple pictures before. This issue of understanding the unfair trade policies, it's important, because when we look at the background of this problem, we look at the trade imbalance. Now, the reason I'm smiling, I'm so sorry, but I send the YouTube link to my dad, but he's answering to another message that I sent him. So, in case you are wondering why I'm smiling, that is what it is. So, I'm going to just put my serious face, because this is a really important issue. So the trade imbalance is one. So when we look at trade partners, this is, it's not like someone who goes to the old bazaar in Istanbul and buys something, right? So there is no agreement between the consumer and the store owner. So these are countries. At the country level, you are looking for a partnership. So I buy certain things from you, and then you buy certain things from me. Yeah. So the imbalance is one of the main problems that we have. And the other thing that we see is I've been talking about the global currency and the other currency issues in the last 3 years. So many times I brought it up here. And what China is able to do and keep their own currency at a lower rate to make others to buy from them. So like people kind of have this feeling of, hey, I have the best, value of my dollar or my currency, but that doesn't work all the time, because if it makes your products more expensive, so that's going to work against you. So then China is manipulating this internally. And a lot of IP theft, forced tech transfers, a lot of not so ethical transactions that we all hear about. And on top of this now is the tariffs and the retaliation. So what, in my opinion, personally, I believe President Trump is trying to do the right thing for long-term, midterm and long-term. But again, I always see people hanging up on the execution of these. But we really need to look at the midterm and long-term impact of what's happening. And also, one of the other things that many people don't understand is the subsidies that comes from the state. So many Americans, we are not so used to that, hearing that, like government is subsidizing private businesses, but someone who was born and raised in Turkey for 25 years, I know there's a huge subsidy, even in Turkey, for supporting their own businesses. But I think for China, this is a little bit out of control. So we'll try to have this question/dialogue style. So I'm going to ask my first question to Anthony. So what makes China trade practices unfair from the U.S. perspective?
I'll start by saying, as a general matter, that bilateral trade deficit is generally not an indication of a problem or an abuse, as a general matter.
Mm-hmm.
But specific to China, and going back to some of the points you made earlier, there are specific trade issues that are inbuilt in the relationship between the U.S. and China that makes China specifically to stand out in terms of its trade practices, right? The most obvious one being the fact that the Chinese economy is essentially run by a communist state, right? And it's not subject to the rules and regulations that you have, say, in a U.S. economy. And in very clear cases, it gives them an unfair advantage. Mm-hmm. So you have that that's built in there already. Then on top of that, you begin to layer in some of the points you made earlier, such as the currency manipulation, right, which directly goes against the World Trade Organization agreements, the GATT, for instance, right? Then you build another layer into it, the IP theft, the first joint venture agreements that sometimes lead to loss of proprietary technology. So those fundamental issues remain in the trade between China and the U.S., as well as with other countries, between other countries and China. Mm-hmm. So you have that established. But the point needs to be made clearly that as a rule, as a general rule, bilateral trade deficits are generally not an indication of a problem or an abuse, except in the case of China, because of the issues that we just mentioned. For instance, the U.S. Brazil has a trade deficit with the U.S. Mm-hmm. They import more from the United States than the U.S. does from them, right? The U.S. has a higher tariff than Brazil has, but the trade balance is in the favor of the United States versus Brazil, but it's not as a result of any nefarious activities. It's not the product of currency manipulation or forced joint ventures and the loss of proprietary technology. It's not the product of IP mm-hmm. theft, and so on and so forth. So the Chinese case stands on its own in terms of the background to the trade deficit. But it needs to also be pointed out that there is a $600 billion worth of goods exchange between both countries, right? What does that mean? It means that $600 billion worth of production is the result of the exchange of materials between both countries, where imports from China lead to production and export from the U.S.
Right, so they're kind of intertwined. Right?
So they're kind of intertwined.
So that's one of the imbalance that we were talking about is that's about 600 billion total between U.S. and China, and then only 25% is bought by China, and then 75% of the purchase is done by us, by U.S. So although these numbers in the total GDP of United States is very small numbers.
Yes.
Like with the GDP of 29.2 trillion. So it's, less than 2% on the import side, 2.4% on the import. On the export side, it's about 0.5%. Although this is not reflecting the actual picture, because what you were saying, this is not just purchasing one of the items from, it's not like the finished product that we are buying.
Yes.
So we are buying maybe the screws of here, screws of there, this piece, and then we are making something else and then start selling that.
Yes, a component part for machinery, ingredients for drug manufacturing that is used in completing the process of drug manufacturing, and which could technically lead to export from the U.S.
Right.
So, yes.
So I think you have the next question.
Yes. Leading up from that, now, we've talked about these imbalances and the genesis of this, right? How, in your view, does this impact the average American, especially because we are in the healthcare business, especially as it impacts consumers from the healthcare side?
Sure. So I think this is the main reason we are actually even talking about this topic today, because this has an impact on average American day to day. So, but are we able to see the big picture? Like if I go to any of the stores right now and then just ask someone to see, just because there's an increase on certain numbers, do they really know what's going to happen in the midterm and long term? So I'm going to actually kind of make sure that we address the issue properly, not just like how I feel about it, but what happens is when we have these imports from China, we pay less.
Yes.
So this phone is, let's say, $1,300. It's probably inexpensive because we get it from China. Now, when we make this phone here, if that's going to cost me $3,000, now we need to just take this thing and then just park it for a second, right? So yes, we pay less, but what's the cost of that? At what cost we are paying less? Now, you and I, we talk time to time about some of these issues. When you look at Michigan State with the auto industry, and when it was the prime time of that, there are still some of the neighborhoods extremely well developed in the old days, but they are abandoned. A lot of people jobless. A lot of people, they're on the paycheck to paycheck jobs that they are not satisfied. They used to work in car factories, auto factories. They used to have a decent job, and they would be able to buy certain things at a even higher cost, but they could afford it. The purchase power is what's important. So now there's the balance of this, and I don't know personally today. I'm not going to pretend like I know the answer for long term, because again, the execution is the part that's, I'll probably keep repeating that several more times today. And if you remember the discussion that I had with John Carney, he kind of agreed with the actual problem being the execution, how we are doing we are going to do something, even if it's right or wrong, how you are delivering that message is important. So if we don't hang up on that issue, we kind of need to look at what's going to happen if I'm able to take this pain right now. What's the return? Can that message be given by the the current administration. And with the politics being as dirty as it is, trying to get that message is not easy because like you have Democrats who used to actually support these tariffs on the record, like 7 years ago, 8 years ago. Today, just because it's done by President Trump, they're going against that. So that's kind of making it difficult for people to understand this because, yes, short term, everyone's going to pay more, including us. Long term, midterm, this is going to probably have a different take. Now, the problem, what's not clear is how soon we are going to be able to see that. When we say midterm, I'm thinking like 12 to 18 months, or is it 18 to 36 months, or is it more than 3 years? That we may not be able to keep things going as much. So that's why we need to see this needs to be done perhaps in a different way. So I kind of like, I think 80% I answered the question because there are some other questions that we have kind of like, we are going to answer some of these a little bit more. But problem right now is we are using the tariffs as like a political tool, almost. Rightfully, wrongfully, it doesn't matter. But it is like we are saying, hey, it's going to be X%. Next day, it's going to be Y%. Now it's going to be a lot higher. Next day, you wake up and then, everything changes. And then the other side is doing something else. So this becomes a political tool. So my question to you is how viable this is using the tariffs, how viable solution, or is this just like a political tool?
Well, the first thing I would say is that tariffs are like a blunt force instrument, right? And the effect of that will cut both ways. Mm-hmm. It impacts the U.S. economy and the immediate time, the likelihood of increasing consumer prices and production costs mm-hmm. for those companies that depend on imported components in the manufacturing process. For the other countries, the EU or China, it will also lead to a negative impact on them. So it's a blunt force instrument. That's the bottom line about tariffs. But more important than that, I think, is the question of what kind of economy do we want to build over the long term? There is no question about the fact, going back to the point that you made about with the example from Michigan about hollowed out factories. Right. There's no doubt that in the process of globalization mm-hmm. and countries seeking comparative advantages, and in effect U.S. companies looking for low manufacturing regions to support their overall bottom line and the manufacturing process mm-hmm. has led to lots of manufacturing jobs in the U.S. and as in the example you gave with Michigan. But then the question comes on the other side of it. If you have a trade deficit with the country of Lesotho, because Lesotho exports mm-hmm. to the United States textiles, right? Mm-hmm. Jeans, denim for Levi's. Mm-hmm. What is your long-term goal? Do you wish to reshore the textile manufacturing that happens in Lesotho in the United States in order to reduce the trade deficit? The answer obviously is no, right? You want to move your economy as technology evolves in the direction of high-value production. Mm-hmm. What does that mean? It means that you give up some in order to evolve your manufacturing process, evolve your economy, advance your economy. And the U.S. has massively gained from moving in that direction. we'll see the revolution that is playing itself out today in generative AI. And the potential it has, the massive potentials in drug discovery, in production systems across the board. Now, do you see, and I'll reverse the question to you, right? When you look ahead, do you see a U.S. economy that is evolving in that direction? Or do you see a U.S. economy, or do you prefer a U.S. economy that is reshoring some of the low-value production from the countries where it is? In the first Trump administration,
I'm gonna, I'm gonna answer that in a very different way. Think about it this way: we, as United Medical, we provide RCM services, medical billing services. What's called is economy of scale. Like when you have the economy of scale, then you are able to provide certain things at a different level, much affordable, but also your expertise can be at a much higher level. Like today, some of our clients, could they do their billing in-house? Maybe, right? So let's say a client brings, let's say, 10 million a year, and then let's say that they pay 5% for their billing fee. How much is that? 500,000.
Okay.
So they kind of went ahead and made this dumbest decision ever and decided to take this in-house. Now they can do that at $400,000 cost. So they save 100,000. So there's some dumbass practice administrator who just got there, which we have seen some of these. You and I, we went through some of these together. So that's why you're probably smiling. They're not like, I'm not making this up. So they went to their bosses and said, hey, I saved you $100,000. But then you look at their collection, that 10 million actually is now 9.2 million. So this is kind of, if you follow where I'm going with this.
Yep.
So you need to pick and choose whether or not you have the right expertise, right ingredients, right setup to do certain things, right? So like Turkey right now, they're really good with textile, but I don't think we can compete with the labor. Okay, so we are talking about $15 to $20 minimum. What's the term that I'm? So this is what's happening these days. Minimum wage, right? $15 to $20. So that's not what it is in other countries. So how much do we want to pay for XYZ? So at what level, at what point? I'm going to give you a different example, and I'm going to, because you and I, we both have, the advantage of having two different countries in our lives. So, and I think maybe some of these you can probably relate from your Nigeria background, and then I'm going to give you the example from Turkey. So in Turkey, you cannot have certain, when you get certain level of engine with the cars, if anything over 2.0 has a different tax rate. So this thing, again, my phone, let's say this is a car. If this is a S500, S550 Mercedes, you have to pay 2.2 of this to the government to own that.
Yeah.
So this is $100,000, let's say. This end payment is $320,000. So why? Because government believes that car doesn't belong to that country because of the level of income distribution and level of the how much they pay for gas, how much they pay for everything else. And that car is supposed to be, like whoever owns that should be paying more.
Yeah.
Okay. So this is done in so many different ways, and so many different countries are doing this in different ways. So when we talk about government subsidy, in Turkey, government is subsidizing electric. and some of the other energy consumption because they cannot pay for the actual amount. Not because they want to create, maybe to your point, why do we do certain things? Like if China is doing it because they have to do it versus if they do it because they want to get that advantage and get an upper hand on other countries. Like Turkey is doing it because its people may not be able to pay the actual cost. So, but if you are subsidizing so they can become much better so that they can cut the prices even lower and then become 80% of your trade, then the problem starts. So I don't know if I kind of like went maybe a little bit out of our script. So it's these things are done in different countries. So we need to choose what this balance is.
Yes, absolutely. And it goes back to the point I made earlier about tariffs being a blunt force instrument because it strikes across the board.
Right.
Yeah.
Are we willing to pay more for everything that we used from day to day just because? Or should we really use, again, this may be a way of reshaping. This is why maybe Trump is misunderstood in many ways. There is an imbalance. That's a fact. And if we can bring one of the diagrams that we had earlier, like when it started back in 30s, that the rate of the tariffs was so high. It's before this one. That's the export import. But right before that, that's it. So that diagram, what it tells you is we were charging more. And then something happened, and then that number went down and down and down and down, and it's way too low today. So that needs to be fixed. So I think that's what Trump is trying to say in this case, because when that number becomes so little now, it used to be 100 times more, you know that both numbers are not right.
Yes, the point I made earlier was that there generally is no correlation between a country's tariffs and tariff levels and the overall trade balance. And that's why I gave the example with Brazil. So there are other factors that come into play in it, and they're not always the result of foul play, as we did discuss in the case of China, in some aspects of the trade practices by China. But it's also important to going back to the graph you showed, to make the point that some of that also has to do with whether a country saves money or whether a country invests.
So maybe if I can give you this example, this was right before the call, and I didn't tell you I was doing this because I didn't know I was going to do it. I called James at our surgery center, and I asked him to send me samples of different products that we use and where they were made. And these are really important day-to-day. If we don't have them, we cannot do surgeries. Now, that's kind of the key. When I say, when I don't have this, I cannot do surgery, you know what other country is able to do? They can cut your healthcare supply chain, and then you cannot deliver what you should be able to do for like life-saving events, right? So first was from Mexico. I'm like, okay, Mexico is a neighbor. We love Mexico. The second one is from Japan. Third one is from Japan. Fourth one is from Japan. And these are different products.
Yes.
And, like, I don't know how much I can get you guys see this, but I mean, like whatever they can see, that's fine. So, I mean, it's one of the main products that we would be using. And then the Japan ones, which was the brand? Can you guess? Probably not. It wouldn't be fair. It's Olympus. Everything that we get from Olympus is almost from Japan. So now there are some stuff that's from China. Yesterday, what I was checking, I think it was with Dr. Erkan. I was looking at something, and it was from China. It was one of the important things. The phones are from China. So, but healthcare, right? So when I don't have, when I'm not able to provide my own, because you may remember, I say this in other sessions, every time there's a hurricane, there's a supply chain problem in the surgery centers. Why? Is because those ships cannot come over, yes. And then we have a huge backlog. So now I think this may be the time to pick and choose what is essential for us. And I think healthcare is essential because here's the thing, Anthony, we are building a new surgery center. And I was talking to Dr. Erkan the other day. With all these changes, we had a budget already. I mean, you are part of it. You are one of the main players getting the license, right? You know exactly what I'm talking about. Yes. Those numbers are doubling. But our income is not doubling. So do we actually stop until these things kind of settle? But we don't know when that's going to happen. We have loan from the bank already approved, so we have a lot of work to do in order to pause it. Or do we keep doing what we are doing, and then now you go back to the insurance companies and say, hey, now you have to pay us more, right? So we are not maybe prepared for this as much as maybe President Trump thinks we are. Maybe it could have been done like once you have certain things in place, 6 to 9 months after you start in the office, then you are prepped for some of these vital things. I mean, I'm okay if I don't drink this water with these vegetables in it. But if I don't have that trocar, I cannot do this surgery.
Yes. So in your view, realistically speaking, do you think it's possible or feasible to decouple the U.S. economy from China?
Not in a short term, definitely not, because we are way too much
interconnected.
Yeah, way too much. I mean, it's not about just, again, like you know this very well. So it's not about the end product. A lot of things, like we think that we are making a car here, and then the 10 parts of the car comes from China,
or Mexico,
or or Japan. So it's not realistic, and it won't happen. But I think the balance, maybe this is a good way to give this message to the other side, in this case, Chinese government, to understand that we are aware of the problems, and we are willing to maybe take certain measures to eliminate some of this imbalance. But even think about it, even we fix this by 25%, wherever it is now, it's 25% more favorable to US. That's huge.
Yes.
So we're going to go to our next topic, more on the healthcare side. So this is we kind of covered it. And then how are we doing with time? Actually, maybe we should just go to our new CMS Administrator, Dr. Mehmet Oz. So because it's 2:43 and this is what I was telling you, like sometimes you don't know how fast the time flies. So with Dr. Oz, so almost was a senator and then missed the opportunity because he didn't call me. I told him to call me and then he didn't. His brother-in-law is Ben DuPont. I reached out to him and he said, oh, he's 5-6 points ahead of the game. Like, if you didn't ask me to donate anything, and I'm one of the well-known Turkish guy in Delaware who could actually help him, and he didn't reach out. So then he lost, right? Now he's back. Now he's the CMS Administrator. Now CMS is bigger than many of the countries, including in Europe,
yes.
Right? So this is a huge part of the government. And I think the current budget is maybe over 4 trillion, 4.4, if I'm not mistaken. So now we have a Turkish CMS Administrator. So I'm kind of, in one way, I'm kind of proud of this. But the other way, I'm kind of like not sure if this job itself requires so many different qualities in terms of understanding how government works. Like, your experience in contracting versus, what I do at the CEO level. If you don't do your part properly, I'm not going to be able to do what I'm doing. So I need the best people in those sections, in those departments to run those. So if I bring a famous TV personality because of the medical background, this job is not for this. And I have said this before, but again, because he's Turkish, now we are gonna give him a pass on this one. But in terms of Dr. Oz's support for work requirements and emphasis on technology, accessibility and quality of care for vulnerable populations, how do we see that? Do you think he's the right person for that?
Well, I look at it a little bit more from a more general perspective, especially as it has to do with responsibility. Now, the issue of work requirements for Medicaid recipients has been there for quite a long time now. It's been in some states, there are some states, especially in the South, that already have inbuilt into Medicaid programs the requirement for work to be eligible for this. Right? And I tend to look at it from the perspective of patient responsibility and the value that this brings in the overall care of the members. I used to be involved in an aspect of finance, development finance, called rural finance, and one of the key ingredients in building up savings capacity in vulnerable or poor populations is the requirement of for those who are in those programs to have skin in the game by being able to save a little bit at a time. And I tend to look at the work requirement from that perspective, not so much from the narrow construct of tying eligibility to having work, right? Because there are multiple factors that come into consideration when you're dealing with vulnerable populations. So, who is this specific patient? What's their capacity? Do they have a disability? And do they have are there other social determinants that are at play? Right? We address the issue of social determinants every day in our work, in our everyday work here. So some of those come into play, right? But I would rather look at it from a broader angle in terms of the whole idea of patient responsibility, because that now dovetails into the responsibility of the patient to be compliant in terms of their drug regimen, be compliant in terms of appointments, compliant in terms of making the best health decisions for themselves and being engaged in their own health care. So we have to look at that from a much broader aspect than just the narrow approach of saying work requirements impinge on the vulnerable population's ability to get access to care. It's much more than that, because after they have had access to care, then there's the issue of the maintenance of that care and the outcome that comes from that. And if there's no patient responsibility that's built into that, we will not get the health outcomes that we seek. So where does that then leave us? we're right back where we started. So I would say that his approach in terms of that, as long as it is seen from that broad perspective, can actually be quite helpful in improving improving health outcomes. But I mean, there are so many things about Dr. Oz that's always been there, come up during his campaigns, and so on and so forth. What is your view of some of his controversial health views?
So, when you are in front of cameras, it's kind of like poisonous. And sometimes I see that as a problem for us, for myself, for the future. Because everything that I have said in the last 4 years can be used against me. True?
Yes.
So now we don't get paid for what we are doing. Imagine if I was getting paid for this. I mean, Mehmet Oz makes his money from TV. Like his main money is coming from TV. So I would probably just even be more liability to you, to United Medical, if I was getting a couple $1 million from this show. So because of everything that he has done and he has said, it's going to be kind of used against him. That's given. Now, there were a couple things where he promoted some of the unproven supplements and miracles, but he also says, and Dr. Erkan is going to be here, and we are talking about bariatric surgery. What's the one thing that we tell people? This is a very powerful tool, but it's not magic. So, he says that, he gives his disclosures. So, but I think he's going to be under intense scrutiny, and he should be. That's fine. But I don't think there will be any problems. I don't think he has done knowingly any unethical things. But these are politics. It's a political position, so people are going to probably bring a lot of issues. Now, what's important to me is that he's a physician. He's trained to do things, process things with the evidence-based policies, and he is one of the people who's trained to work with other surgeons, physicians. Therefore, I do believe that he's going to have a good impact overall. Now, we are going to have Seema Verma, who used to be the former administrator of CMS, and I do want to ask her a couple of questions regarding this. And I almost thought she was going to be back, actually, for this position. But it's going to be interesting to hear what she has to say, because she also worked with President Trump. But these are really important positions, and I think he is the right person to go. Now, we do have his information. Mehmet Oz is on our phone, so we are going to invite him. I'm going to either go through directly to him or to his brother-in-law from DuPont Country Club. So we'll figure out a way to bring him here. But I think he's going to have a good impact on overall healthcare. One last thing that I want to ask you, Medicaid cuts are kind of, it's been, everyone is talking about like what's going to happen to the Medicaid population. These are a vulnerable population, and someone who's a physician comes into this. What do you think his impact is going to be on the Medicaid population?
Well, it's. I think the first thing is that those budget cuts are the product of congressional action, and the budget blueprint that's just passed the House, as well as the Senate version of it, it's already built in quite an extensive amount of cuts on the healthcare side, specifically on Medicaid. The expectation is of a budget cut in the region of $800 billion. Now, this is expected to impact especially the parts of the Affordable Care Act population, which led to Medicaid expansion in several states. And the impact of this, it will be that it will trickle down to the states, obviously, because the Medicaid is a state and federal partnership. And you would expect that at the very minimum, it will lead to loss of coverage for certain those certain number of those in the Medicaid population. That is almost a given, especially as it has to do with the expansion, the Medicaid expansion. That population especially is more than likely going to be affected, especially again because these are immediate cuts that are expected. So state governments will have to make decisions on how to adjust. And ultimately, this will also impact the hospitals because it's going to mean that some of the hospitals will unfairly bear some of the burdens that come out of these budget cuts. It also expectedly trickle down to the ACOs, such as us, because not only will we lose those who are already attributed to us, that will reduce the margins that we have in terms of medical loss ratio and ultimately shared savings. So the impact is going to be across the board, beginning with the patients and then going all the way to the practices that rely on these for reimbursement. There are some rural hospitals in the country that are in great peril as a result of these expected Medicaid cuts, because they are disproportionately reliant on the Medicaid population. I'm talking about rural hospitals in places like Louisiana, Mississippi, and so on. So there is very little doubt that it's going to have a big impact, and it will be immediate because these are expected to happen as soon as the budgets get passed.
But I still believe that Dr. Oz probably is going to have, he's going to push for the value base and then trying to see which organizations are able to make more efficient impact with the Medicaid programs. And I think with the ACOs, although I see what you're saying in terms of how this may change the certain balance, but at the same time, the need for an efficient organization is going to be there.
Yes, it will definitely put greater emphasis on the full transition to value-based care as a more efficient model, not just for managing patients, but also for managing healthcare costs and the overall financing of healthcare. He also talked about an increased role private partnerships in this. And I have often thought that is one aspect of the healthcare system in the United States that is not emphasized as much as it should. There is role for the private sector in partnerships, but more often than not, when you talk about the private sector in healthcare, the tendency is for people to think about private equity.
Right, that's not what we are talking
but
about.
That's not.
Actually, they are going to make the healthcare costs even more.
Yes.
Yeah.
Yes.
Well, Anthony, thank you for joining me today. I know we went through a lot of different questions, topics, and it's one of those times. It's not an easy time for the country, and understanding what's happening and maybe providing another source for those who are looking for objective views. This would be a good episode to watch. We'll be back with our Bariatric Friday with Dr. Erkan, and we'll also be back next week, same time, for more updates. Thank you for watching us. There, so you can let me know when it's time.